An update now on the pandemic. As the numbers steadily decline in Oregon, today the health authority reported just under 2,000 new cases. Hospitalizations have now fallen below 800. In the past 2 weeks, the daily average of new cases has dropped more than 60%, and hospitalizations have dropped by about 30%.
While the numbers are heading in the right direction, Oregon's hospitals are still strained, and that may not change anytime soon.
Capacity issues could last for months, if not years. Fox 12's KANDRA Ken is live tonight with why experts say the healthcare system is badly damaged. KANDRA?
Yeah, that's right, Nora. And if you've had a delay in seeing a doctor or a specialist or even getting basic care, you're certainly not alone at this point. And even in this phase of the pandemic, as it's winding down, the effects could last for years. COVID-19 has dominated all talk, healthcare and hospitals throughout the pandemic. But as the Omicron wave of the virus peters out, it's important to focus in on a real big elephant in the room: hospital capacity and staff shortages.
This is a long-term problem that's going to last beyond Omicron.
Experts say even if COVID did go away, hospitals would still struggle, likely for years.
The near-term crisis may be over, but hospitals are going to continue to be very full.
Becky HULTBERG is the president and CEO of the Oregon Association of Hospitals and Health Systems. She told us there were cracks in the system even before the COVID era, such as trouble discharging hospital patients into appropriate levels of, say, rehabilitative care, like skilled nursing homes.
The pandemic made the situation far worse.
Couple that with the problems that emerged alongside the pandemic.
The biggest factor in the workforce shortage is burnout and fatigue of healthcare workers.
It's at a crisis level. Across the nation, 1 in 5 healthcare workers has left the industry.
You really need to think about this as almost a generational issue. We have had such a significant staff shortage during the pandemic. It's going to take a really long time for us to work our way out of it.
So what does that mean for you as the patient?
I think that there's a huge amount of pent-up demand to seek care. There definitely have been people that have, delayed some of their care.
I think that some of the delay may lead to some more advanced conditions until we dig out of this.
Dr. Chuck Duvall is the medical director of surgery for Providence of Oregon and chief of surgery at St. Vincent. He says the hospital has become more efficient and faster in the operating rooms, but staffing continues to be the biggest issue. He says if the hospital can get more caretakers on board,
I'd be optimistic that we can do what needs to be done over the next several months and get people taken care of.
Healthcare providers say they do ask for patience as they try to catch up. Their advice: plan out your preventative care in advance, but speak up if illnesses or injuries emerge.
We want you to advocate for yourself, to escalate if you're actually not getting what you need from our healthcare system and things are getting more urgent. Let us know.
And the Oregon Association of Hospitals and Healthcare Systems says that some bills introduced into the legislature could be a really good first step in solving some of the workforce issues. And that includes a nurse staffing bill as well as an OHSU bill that would expand its ability to train healthcare providers. Reporting live at our mobile newsroom tonight, KANDRA Kent, Fox 12 Oregon.